Hi, this is Dr. Cameron Afzal. On one of our posts, a patient asked us the difference between edema and lymphedema. And today I'm going to talk about three different things. One is edema, which is swelling. And edema can happen because of many reasons. Edema can happen because of a bee sting. It can happen because of injury, a fracture. The swelling that happens after a person has fracture is edema. It can happen with chronic conditions like heart failure or kidney disease. It can also happen because of liver disease or poor nutrition. That is edema. Sometimes it is localized and sometimes it is everywhere. Uh, then coming to the topic of lipedema. Lipedema is a disorder in which fat is deposited unevenly. So the fat is deposited more in the lower legs and around the ankles. And for example, a person may be size 8 around the waist, but they would be like a size 16 around the ankles. Uh, this is a problem that can get painful, and there are many different avenues that one can go for treatment. So the treatment for lipedema would be compression, it would be exercise. Uh, a person who's really interested can have liposuction, manual lymphatic massage, and a good nail and toe and feet care is very important because of the chance of infection. It is something that a person generally has to live for the rest of their life. And then there is something known as lymphedema, which is swelling or edema because of a problem with the lymphatics. Lymphatics are these special type of vessels that carry highly rich protein fluid from the extremities or different organs to the heart and back to the main circulation. And when they are blocked because of infection or radiation, as in the case of cancer, or because of any trauma, that part of the body will swell up. The reason a person has edema with lymphatics is because lymphatics are these vessels that carry protein concentrated fluid in them. And protein tends to attract a lot of water. It has a lot of osmotic pressure to it. So what happens is that if that fluid gets stuck somewhere or a part of the body is not able to get rid of that high protein fluid and dump it back into the circulation, water comes from all over the body and you have localized swelling, and the water is pulled into the tissue because of the high protein content. Uh, and that is why those patients have swelling. And again, their treatment for that would be similar to uh, any kind of edema. It would be the compression, the exercise, it would be lymphatic massage, and a couple other things. So again, the three things are edema, which is can be temporary or permanent, can be localized or generalized, and that is just a medical term for swelling in any area. And then number two is lipedema, which is a deposit of fat. It's not swelling, it's just fat deposit in the wrong area, and it's generally below the knee and above the ankle, and it's in females, and it's because of hormones, etc. And then there is lymphedema, which is a problem with the lymphatic vessels, and lymphatic vessels are the ones that carry the high rich protein fluid from the extremities back into the circulation. If you have questions, please do comment and I will try to answer them. Thank you.